My name is Dr. James Underberg. I am a clinical lipidologist. I'm also an internal medicine specialist or an internist. And I am so excited to be here today. It's 12 noon Eastern Standard Time. And I have been allowed for 15 minutes to take over the Medscape Instagram live feed. I'm doing this on behalf of the National Lipid Association. I am a past president of the National Lipid Association and current president of the American Board of Clinical Lipidology. I'm a clinical assistant professor of medicine at the NYU School of Medicine and the NYU Center for Prevention of Cardiovascular Disease at NYU Langone Medical Center. I'm also the director of the Bellevue Hospital Lipid Clinic in New York City. My office is based here in New York. I'm a lifelong New York resident. I went to medical school at the University of Pennsylvania. And I'm here today to talk to you about a couple of different topics that all stem from a recent National Lipid Association, what we call Clinical Lipid Update. This is a enduring program that you can actually still go and download and watch for free if you're interested in this space. You can find us at lipid.org/spring CLU. And that's where you can actually watch some of these sessions. We did a session early on in the meeting focusing on lipid clinics, telehealth, what we call shared decision-making, making decisions between patients and providers. And so I'm going to talk a bit about all of those things over the next 10 to 15 minutes. And then if I have time at the end, talk a bit about an area I'm very interested in as a lipid specialist, which is inherited causes of high cholesterol, in particular something called familial hypercholesterolemia. So it's 12:01. I'm going to jump right in and just remind you that my Instagram feed is at LipidDoc. You can also find me on Twitter at LipidDoc. I'm taking over the at Medscape Instagram feed right now on behalf of the National Lipid Association at National Lipid Association, which is both Instagram and on Twitter. And so at this recent meeting, one of the first things that we had an opportunity to speak about, and I focused on what's happening with telemedicine right now, both in medicine and in lipidology in general. And I would tell you that telemedicine has really been a wonderful addition to how we care for patients with lipid disorders. Again, ideally, providers would like to meet their patients in person, and that's always optimal. But in cases where people have cholesterol disorders, triglyceride disorders, abnormalities in lipid metabolism, very often much of what we do is taking a history and going over lab results. And there are even some parts of the physical exam that we can actually do via telemedicine. I can pull someone up close to a screen, look in their eyes. I can teach them how to examine different parts of their body themselves, feel tendons and look at their skin. Patients can take their blood pressure, their pulse, their temperature, measure their waist circumference. There are so many things that we can do with telemedicine now that being able to provide increased access has really been one of the silver linings during this last year. What are some of the strengths of telemedicine? Well, availability, right? Lipid specialists, there aren't a ton of us around the United States. We tend to be concentrated in urban centers or in academic medical centers, although there are lipid specialists that are not in urban centers or affiliated with academic medical centers, but there aren't a lot of us, so we're not necessarily geographically close to everyone. And so telemedicine allows me to expand the area by which I can see people. Availability is the other thing, right? That being in an office at a specific time is often a little more difficult than finding a time for a telemedicine visit. And telemedicine visits don't have to be done necessarily during office hours. They can be done in the evening or on the weekend. And so there's a big advantage to availability. Cost is another issue. Some patients have to travel for an in-person visit. And especially if you live in a more rural area and have to go to a urban center, that may require time off work. It may require a cost of travel. train, parking, bus, whatever it is that you're doing. I have patients who see me from all over the tri-state area, up to northern New York and Connecticut and Long Island and Pennsylvania and New Jersey. And so not having to pay for that travel and saving the cost of the trip or time off work is another potential benefit. And the other one that I really didn't think about until we started doing more telemedicine visits was the ability for others to collaborate on that visit. So for family members to be present if they otherwise couldn't be present. Someone to stick their head in and add their 2 cents to the visit. This person isn't telling you about X, Y, or Z, or they forgot to tell you about the following. And so the ability for others to be part of the visit who otherwise may not, I think, is another real strength. What are the weaknesses of telemedicine? Well, you're not in person. And so there are things that we can't do via telemedicine that we can do in person. And our office is open. Most physician practices are open. Most provider practices are open, whether it's nurse practitioner, physician assistants, et cetera. And so there are times where I'll strongly suggest someone try to come in. But again, having that telemedicine option available, I think has been great. So next, I really want to kind of segue into lipid clinics in general. What is a lipid clinic? A lipid clinic is a practice. It can be a individual practice. It can be a specialty clinic embedded in a healthcare system or hospital, focused specifically on patients with disorders of lipid, cholesterol, triglyceride metabolism. We see patients with severely elevated cholesterol levels, inherited causes of high cholesterol, difficult to manage cholesterol disorders, triglyceride disorders. Patients who have side effects with medicines often get referred to us. Patients who have complicated diagnoses. People who have premature heart disease or recurrent pancreatitis or other disorders that are associated with lipid abnormalities often get referred to us. And the sources of our referrals are varied. I will tell you that while we have patients who are referred to us by other providers, we also have patients who self-refer. They find us online. They read about what happens in a lipid clinic. They search us out. How do you find someone who is running a lipid clinic? Well, there are a couple of actually really good websites. One is through the foundation of the National Lipid Association, and that website is learnyourlipids.com. learnyourlipids.com. A lot of great information on that website. If you have a condition called familial hypercholesterolemia, the other site you can also go to is the FH Foundation, and their website is thefhfoundation.org. And both of these have locator maps where you can find a lipid specialist near you. And I think that's a great source of that. Now, who is a lipid specialist? Someone who's interested in managing patients with lipid disorders. And one of the great things about the National Lipid Association is we're open to anyone who's interested in the management of patients with lipid disorders. We're one of the only medical organizations that I think truly is open to every specialty, both physicians, MDs, DOs, nurse practitioners, nurses, registered dietitians, physician assistants, pharmacists, exercise physiologists. Any of these groups can manage patients with lipid disorders. Any of them can direct a lipid clinic or be part of managing a lipid clinic. And they all are integral and important parts of our organization and actually our leadership group. And I think that's truly one of the unique things about this. And so again, a often multidisciplinary collaborative group, although it can necessarily sometimes just be one. I'm very lucky. I manage a lipid clinic at Bellevue Hospital here in New York City, and I get to work with a wonderful nurse practitioner, have been able to collaborate with pharmacists. Also, it's a great place for training, and so both fellows and house staff officers, meaning interns and residents, and even medical students are involved in our program. And so that's all been wonderful. We're about halfway through. And so I wanted to just take a break for a second and remind you, my name is Dr. James Underberg. I'm a clinical lipidologist, and I am taking over the Medscape Instagram live feed for 15 minutes on behalf of the National Lipid Association. And again, you can find me at LipidDoc, both on Instagram and Twitter, and the National Lipid Association at National Lipid. So next I want to move on to a very important concept that I think is key and important to the management of patients with lipid disorders, and it's called shared decision making. Shared decision making is part of our guidelines. It's integral to making sure that the patient and the provider both have a very good informed discussion about the patient's risk, whether it's heart disease risk, whether it's risk of pancreatitis in patients with high triglycerides, whether it's stroke risk, vascular disease risk, and what the interventions are to reduce that risk. And those interventions are multifactorial. They're often lifestyle-based, diet, exercise, managing emotional stress, and other factors that influence heart disease. They could be pharmacologically based with interventions. And the whole point of shared decision-making is to understand the patient's goals, attitudes, background, culture, environment, and even finances, right? And then make sure they understand the risk-benefit associated with the interventions you're going to discuss. It's very important to tell a patient what you think makes the most sense, but then it's up to you and the patient to come to a decision together on how to manage that disorder. And if that happens, and if you do go through this process of shared decision-making, and I'm talking both as a provider, but also to all the patients out there, what does this do? It improves adherence. It improves outcomes. It improves patient satisfaction. And it also means we're following guideline-based recommendations. And again, the National Lipid Association was one of a whole bunch of organizations that were part of our most recent iteration of guidelines for the management of patients with cholesterol disorders, led by the American Heart Association and the American College of Cardiology. But the National Lipid Association was a proud partner in that process, along with tons of other organizations that have signed on to this. And so again, shared decision-making is a key and important component. And so with the last couple of minutes left, I did want to spend a little time talking about a very common, believe it or not uncommon, but common inherited lipid abnormality that I spend a lot of my time taking care of, called familial hypercholesterolemia. And this is one of the major reasons people see a lipid specialist, a lipidologist. Familial hypercholesterolemia is otherwise known as FH. And that first part, F, familial, stands for family. This is inherited. And this is a more common condition than people think. In general, across the country, it's seen in about 1 in 250 people. But in certain areas of the country, like where I practice in New York, maybe in California, in Florida, and other areas of the country, you might see it as common as 1 in 150 people. And what is this? It's people who have very high cholesterol levels, often greater than 190 milligrams per deciliter for the LDL cholesterol. The total cholesterol can be in the 200 to 300 range. These people have a family history of high cholesterol or premature heart disease, one or the other, or both. And if a parent has it, the likelihood of their children having it is 1 in 2, or 50%. Now, you can flip a coin 10 times and it can come up heads 10 times. So it doesn't mean that 1 out of 2 kids has to have it. But the reason I'm saying this is that if you have been told or you think you may have inherited high cholesterol, one of the important reasons to know about it and make the diagnosis is to screen family members, to screen kids, to screen parents, to screen siblings, right? I always say north, south, east, and west when it comes to screening family members. That's just as important as treating the individual patient. Now, lifestyle and diet is a key component of managing familial hypercholesterolemia, but also we often use or have to use several different cholesterol-lowering medicines to manage patients who have severe elevations. And we treat patients beginning at an early age if they need to, because if you do lower cholesterol in patients with familial hypercholesterolemia, you significantly reduce the risk of heart attack and stroke later in life. And for people who have this condition, their lifetime risk of having a heart attack or stroke is elevated 20-fold greater than someone who doesn't have familial hypercholesterolemia. So lipid specialists are integral and part of managing this common condition. You can find more information about familial hypercholesterolemia either on the FH Foundation website, as I mentioned, that is the fhfoundation.org, or the website of the Foundation of the National Lipid Association, which is learnyourlipids.com. And again, if you think this is a condition you may have or a family member may have, it's so important to get it checked out because it's something that we can treat. And treating it actually brings the risk associated with it back down to someone who doesn't have the condition. So that's such powerful information to know it's something you can find, that you can manage, and you can prevent. And so I've got about 1 minute left. I'm just going to wrap up and let everyone know that lipidologists come from all different areas of medicine. I'm an internist. You can do this as a cardiologist, as an endocrinologist, as a nurse, as a physician assistant, as a pharmacist, as a registered dietitian. We're all important components of this team. It's a wonderful area and field of medicine, and I'm very lucky that I've been able to help patients for as long as I have, and I've been able to teach and collaborate and write and do research in this field. I love what I do, and I think it's so important to find a field of medicine that you enjoy, and I'm very lucky because my colleagues in this space are exactly in the same kind of setting I am and feel the same way about this. And so it's 12:15 now. I'm going to sign off. Again, my name is Dr. James Underberg. I'm a clinical lipidologist. You can find me at LipidDoc, both here and on Twitter. I really appreciate Medscape allowing me to take over this Instagram live feed. And I appreciate the National Lipid Association for the opportunity to be our representative in this particular endeavor. So I hope everyone has a great Wednesday and a great rest of the week. And hopefully I'll see you again soon. We may try this again. All the best.